A recent article in People magazine shared the story of a young Wisconsin family, the Ulmers. Mom, Wendy, Dad, Steve, and their 4 boys. Everything normal. One night they go to bed, middle of the night, at only 36 years old. Mom takes her last breath. No warning signs, no health issues. She simply went to bed and never woke up.
Steve later said Wendy had issues with an irregular heartbeat in the past, and the day before her death, he says she complained that she was experiencing that again. The coroner later determined Wendy died of something called cardiac sarcoidosis, 2 different conditions with the same denominator, the heart.
We would like to introduce you Dr. Stephen Keim. He's an electrophysiologist at Peninsula Regional Medical Center. Thank you so much for coming in today.
Thank you.
We hear a lot about heart attacks, but there are so many other conditions that can affect your heart, isn't there?
Right. The heart is a primary electrical organ. It manifests itself in a variety of different disease states, but always in the end it comes up with some electrical problem as a manifestation, what you might call an irregular heartbeat.
Yeah, and that's what we're targeting today, specifically AFib. What is that?
Yeah, so AFib is an exceedingly common, the most common irregular heartbeat that people or patients experience, and it is a fast, irregular heartbeat that is associated with a variety of different medical diseases.
So typically, will somebody know if they have atrial fibrillation or AFib?
Right. So generally people may not recognize it, but on further questioning and examination, they'll be able to express a lack of what we call functional aerobic capacity. They just won't have the energy to do what they want to do. They'll be more breathless walking up the steps. They won't have energy to do it. 50% of the patients will be aware of palpitations or an irregularity in their chest or in their throat.
Okay. So how do you treat something like this?
Yeah, so there's good news on that horizon over the last couple of years. When a physician speaks to a patient about atrial fibrillation, there are 2 key points that are on the mind. One is obviously the symptoms that the patients manifest with it, but also there's a darker side to atrial fibrillation, and that is the manifestation of having a stroke. So a patient is in the first interview examined and interviewed with the intent of dealing with what their symptoms are and in their risk of having a stroke. In treating their symptoms, we've been doing it literally the same way since the 18th century with medicines that date back that far, interestingly enough. But it has to do with slowing the heart rate and regularizing it. And that can be done with medicines or pacemakers. In the last several years, there's been a newer strategy called radiofrequency or cryoablation, where areas of the heart are actually frozen or destroyed, that allows the restitution of sinus rhythm. And in the last year, there was a very large study that was presented with a long-term follow-up that demonstrating that ablation was as effective and as safe as the medicines that we have.
Okay.
In regards to dealing with the stroke, we have a medicine that we've had as long as both of you all have been alive, warfarin or Coumadin, affectionately known by my patients as rat poison. But over the last several years, we've had the development of 4 or 5 different medicines that make the administration of anticoagulation in those patients who need it much more effective.
Okay, let me ask you this. Apple said earlier this month that their new Apple Watch 4 could detect AFib. Could it be as simple as buying a gadget like this to determine whether or not we have AFib?
Yeah, certainly nothing's that simple with it. The over-the-counter wearable technology is going to explode in the next several years, and it stands an opportunity to offer a lot of different improvements. The Apple Watch, in its very particular application called Cardia, K-A-R-D-I-A, is the first FDA-approved application to deal with atrial fibrillation. So, if a patient had the concern of atrial fibrillation, it would involve the Apple Watch, but also the addition of the Cardia. I think Apple also has a monitoring system that's on all of its watches, or its newer watches, That doesn't bring to it the same level of diagnostic accuracy, but certainly is helpful in the sense that it gives the patient a tracing of an EKG to bring into the physician to review.
Okay.
So it will engender a lot of conversation. Some of it will be not important because there's a lot of problems with those types of wearables, but that's okay. Conversation is good. A physician spends a lot of time worrying about what might happen to their patient.
Right.
And so this conversation can lead into all the other things that one might want to talk about if they're concerned of atrial fibrillation.
So it's a good conversation starter.
Right.
Yeah, it is.
Electrophysiologist Dr. Stephen
Thank you so much.
All right.
Keim with Peninsula Regional Medical Center. Thank you so much.
All right.